Good morning students. So today I discuss about the topic is a peptic ulcer. So what is peptic ulcer? Peptic ulcer is a lesion of the mucosa and increase the HCl acid secretion. When the acid secretion will be there in our stomach, so now the gastric acid secretion will be increased. When the gastric acid secretion will increase, when the bowel syndrome is also increased. So that are the main function of the peptic ulcer. So now the pathophysiology of the peptic ulcer. So it is the main anti-H. pylori in the bacterial cases increase the peptic ulcer. So now there is a risk factor. So first factor is the lifestyle, and the second factor is the age, and the third factor is the genetic factor, and the fourth one is the gender. Now the classification of anti-ulcer drugs. So what are the main classification of anti-ulcer drug? Like the H2 blockers. So what is the H2 blockers? Like H2 blockers mean H1 receptor is present on the parietal cell, and H2 blocker is the Ranitidine, Famotidine, and the Roxadine is the main example of the H2 blocker. Now the comes to the second point is the proton pump inhibitor. So what is the proton pump inhibitors? Proton pump inhibitors mean there is the Omeprazole, Pantoprazole, that are the main example of proton pump inhibitor. So now the third classification is the anticholinergic drugs. Like what is anticholinergic? Because that drug are the cholinergic receptor is blockers, like the Misoprostol and the Micoprotective, but it is also used to the oral contraceptive pills also. So now the third classification is the Antacids. So what is the Antacid? Antacid means it is the used to the after ingestion of the food. So that is called as an Antacid. Antacid is a two type, that is a systemic, and after another one is a non-systemic. So what is this systemic? Because the systemic means there is a sodium bicarbonate means Na2HCO3 main example of the systemic antacid, and the non-systemic antacid is the aluminum hydroxide and the magnesium hydroxide. So now to the another drug is the ulcer protective. So ulcer protective means the anti-H. pylori drug, like the Sucralfate, that is the protective drug of the ulcer. Now the mechanism of action of the anti-H. pylori drug or the proton pump inhibitor. So first mechanism is proton pump inhibitor. So what is the proton pump inhibitor? Because the proton pump inhibitor mainly it is block the proton pump, like it is block irreversibly, because it is the main function is to it is block the irreversibly. It is the main example is Omeprazole or the Omeprazole or Pantoprazole. Now the come to the second mechanism of action, the H2 blocker. So what is the H2 blocker? The H2 blocker is the present in the parietal cells, then it block the H2 blockers. When the H2 blocker is receptor, it inhibit decrease the gastric acid secretion. When the gastric acid secretion will be decreased, reduce the acetylcholine or HCl secretion will be decreased. Because of that acetylcholine is the muscle contraction will be there. So when the muscle contraction will be there, the HCl secretion will be there. So that are the main mechanism of H2 blockers. Now the interaction. So what are the interaction? Like the H2 blocker mean there is a ranitidine, famotidine, that is the drug of the H2 blocker. The famotidine reduce the hepatic blood flow. So when they use the anti-epileptic drug like the theophylline or the bromphylline or the phenytoin, because it is anti-epileptic drug. So when the anti-epileptic drug will be used and add to the H2 blocker, the absorption of H2 blocker. So H2 blocker mechanism will be inhibit in the main responsible to the anti-epileptic drug or the theophylline or the bromphylline. Now the third mechanism of action will be there, like the proton pump inhibitor. So it is the proton pump inhibitor means Omeprazole. It is the irreversibly block the proton pump inhibitor, like H plus K plus ATPase, H plus K plus ATPase. So it is the main mechanism, it is the block the irreversibly. Now the anticholinergic drug, like the anticholinergic mean the Misoprostol, and the antacid will be systemic and non-systemic. So this is the overall it is the class of the peptic ulcer. Thank you.